In order to understand where our healthcare system is, the first logical question to ask is it doing a good job keeping people healthy? Let's look at some stats. As of 2020, life expectancy at birth for US citizens was 3 years below its international peers on average. Avoidable deaths, meaning deaths that can be avoided through effective public health measures, were 20% above average. And US citizens are 20% more likely to have multiple chronic conditions over their lifetime. So why are US health outcomes so poor compared to the rest of the developed world? Is it because we don't spend enough on healthcare? Even when adjusting for national wealth, the US spends about twice as much on healthcare per capita as other developed nations. So we're spending more on a healthcare system that is yielding less than impressive outcomes. That doesn't seem right. So why do we spend so much? Is it because we use more health services? We actually have fewer physicians, visit physicians less, stay in hospitals for shorter amounts of time, and even have fewer hospital beds. The key seems to be the structure of our healthcare system. Across most developed countries, the structure of their healthcare systems comes down to two questions. Who owns and operates healthcare providers, like hospitals and clinics, and who provides health insurance to people? For both of those questions, the answer is either the government or the private sector. In the US, we have a fairly unique system, where all healthcare providers and professionals are privately operated and employed, and the majority of people are insured by private insurance companies. But we also have government-provided insurance for people over the age of 65, for people below the poverty line, and for veterans. Where the US is really an outlier is in the share of its overall healthcare spending that belongs to the private sector. There are over 1,000 private health insurance companies in the US that, according to the 2022 census, collectively cover about 65% of Americans. This means our system is much more fragmented than in other countries where the majority of people are insured by the government. As a result of this fragmented, decentralized structure, there are lots of extra layers of administration in hospitals, insurance companies, and government healthcare offices that exist mostly just to coordinate with each other. This contributes to higher expenditures, as well as the burden of slow and complicated processes for patients. It also contributes to high prices on drugs and health services. In countries where the government insures the majority of people, the government then has enough bargaining power to negotiate fair prices for health services and pharmaceuticals for patients. But the US has such a distributed collection of insurers that none of them have enough bargaining power to do so effectively. One study surveyed almost 2,000 US hospitals and found that many were charging significantly higher prices to patients paying with private insurance than they were to patients with government insurance. In an effort to keep prices more honest, in 2022, a law was passed that requires health insurers to disclose the prices they negotiate with healthcare providers, which is good, because in 2022, more than 1/3 of Americans reported struggling with medical bills, and overall, medical costs are the #1 cause of bankruptcy in the US. Another important question to ask is, does our system provide care to enough people? Most uninsured Americans are people that work low-wage or part-time jobs, where they earn enough not to qualify for Medicaid, but their employers don't offer medical benefits. In 2023, 7.4% or 25.5 million Americans don't have health insurance. For reference, that's more than 3 times as many uninsured people than there are in the entire European Union. And that number is actually at an all-time low, following a record-breaking enrollment period for the Affordable Care Act. Commentators suggest that further reducing the number of uninsured Americans will entail either expanding government insurance or subsidizing people to pay for private insurance, which is what the Affordable Care Act does. But even if we got everyone in America insured and instituted reforms to make care more affordable, there's still the issue of why our outcomes are so poor. Some argue that the issue of our system's effectiveness is its bias towards reactive versus proactive care, meaning that we focus more on treating sick people rather than preventing people from getting sick in the first place. The CDC estimates that 90% of US healthcare expenses go towards treating chronic diseases like diabetes, cancer, or heart disease. Meanwhile, proactive care is largely neglected in the US, especially when compared to other countries. Proactive care is often less expensive than reactive care, and has the benefit of reducing the prevalence of chronic diseases that are uncomfortable for patients and have a huge strain on the healthcare system as a whole. So what's stopping us from shifting our focus to proactive care? Experts say that the key to providing effective proactive care is maintaining regular communication between patients and providers and being able to gain predictive insights on patients' future health needs so that they can offer informed and personalized recommendations. Unfortunately, doing that would require a centralization of patient data in order to gather these insights with sufficient efficiency and accuracy. And as we mentioned before, our system is anything but centralized. So it seems our healthcare structure is both making healthcare more expensive and is also preventing us from transitioning to a more promising model of proactive care. If our system structure is such a problem, then why don't we change it? Whether or not we should transition to what's called a single-payer system, which would essentially expand Medicare to all citizens, has been hotly debated for the last several decades. I won't get too into it now, but if you're curious, the video linked in the description does a pretty good job of covering the nuances. When it comes to the less radical proposal of establishing a centralized record of patient health data, most of the barrier to do so is political. Such a system would almost have to be owned and operated by the government. And between developing the system itself and then helping providers, insurers, and pharmacies make the transition to start using it, such an initiative would have a massive upfront cost. Selling the public on expensive projects is never easy, and politicians are typically incentivized to steer clear of backing such projects where the costs of the project present themselves in the short term, and the benefits aren't observed until later on, potentially after their term in office ends. And it doesn't help that many of the pharmaceutical and insurance corporations that have profited most from our system structure spend more on lobbying Congress than any other industry. In sum, our healthcare system is currently lagging its international peers in outcomes, affordability, and accessibility. In the end, some experts have voiced that what's most pivotal is that we, as a country, start fundamentally changing our perspective on healthcare and start viewing it as an investment rather than a cost. If we're able to change our societal narrative on healthcare, we may be able to gather enough support to make the changes necessary to turn our system around. Because it's like they say, health is wealth.